we go. All right, welcome everybody. We're happy to have you with us today. We are presenting 9 ways to reduce your cancer risk with the University of Texas MD Anderson Cancer Center. We are fortunate enough to have Kendra Windisch here with us. She is a Senior Community Relations Specialist in Strategic Communications at the University of Texas MD Anderson Cancer Center. She coordinates charitable sponsorships that support the local community and collaborates with nonprofit, civic, and business organizations to educate the public about cancer prevention, basically what we're doing here today. Kendra received her undergrad degree in community health and psychology and a master's degree in community health at Sam Houston State University. We're happy to have her here. We're happy to partner with MD Anderson. If you have questions throughout today's presentation, we are Facebook Living this, so feel free to put your questions either in the chat section or in Facebook Live as well. And with that, Kendra, I'll let you take it away.
Great, thank you, Matthew. We're happy to be here. Patricia is also on the call, and she's from MD Anderson Cancer Center as well. She'll be facilitating the questions. So make sure and type your questions in either on Facebook or Zoom, and we'll get to those at the end of the presentation. Thanks for having us. We're thrilled that we could deliver this presentation during these times of social distancing. Before we get started, I do want to mention that I am at MD Anderson today down in the Texas Medical Center, and we are required to wear masks, but I am in an office by myself, so I've taken mine off so I can do the presentation and you all can hear me better. And a quick reminder, MD Anderson really wants to let everybody know that the importance of wearing a mask and social distancing and washing your hands frequently, especially right now while all the numbers are increasing. So please keep that in mind as you go throughout your day. And to reduce feedback, we're going to keep everybody on mute if you are on Zoom. And then again, like I mentioned, if you have questions, go ahead and type them in as we go along, but we will come back at the end and answer those. Also, if you're on Zoom, we're going to make it a little bit interactive. So I will ask some questions during the presentation. You can click the thumbs up on the reaction button to kind of answer those throughout the presentation. Okay, so 9 ways to reduce your cancer risk. Let's get started. So here's a question. It doesn't matter what I do. If I'm going to get cancer, I'll get it no matter what. So kind of a true-false question. If you were on Zoom, I'd ask you to click the thumbs up. So it doesn't matter what I do, I'm going to get cancer. If I'm going to get cancer, I'll get it no matter what. Actually, about half of cancer deaths are thought to be preventable. So that is not a true statement. There are things you can do. There's actions you can take in your day-to-day life that can help lower your risk. Cancer is not inevitable. There are also screening tests that you can get to look for cancer, and that's when we want to catch it in its earliest stages and most treatable stages. So our objectives for today's presentation, we're going to increase your awareness of the cancer risk reducing behaviors that I'm talking about, screening exams and screening recommendations, hopefully motivate you to identify and adopt these risk behaviors, and then encourage you to talk to your doctor about screenings. All right, number 1, maintain a healthy weight. 1 out of every 3 cancer deaths is thought to be due to obesity and overweight, lack of physical activity, and poor nutrition. And we're going to go over each of those today. Being overweight does increase your risk of several cancers. So one way you can maintain a healthy weight is to eat less and move more. And I know this sounds very easy, and if it were that easy, we would all do it and we'd all do it correctly, but we all know it's a little harder than it looks. So if you need to lose weight, you want to eat fewer calories and burn more calories by exercising. And remember that you can't just do one or the other. If you love to exercise, but you still overeat, then your body fat will remain high and your cancer risk will also remain high. So you need to find that balance in your life where you're eating a little bit less and moving a little bit more. During all these times of COVID and all the stress that we're all feeling, good nutrition can also boost your mood. It can help with the unwanted weight gain and reduce your risk for cancer and other chronic diseases as well. All right, number 2, eat a plant-based diet. MD Anderson recommends that you fill 2/3 of your plate with plants every meal. And I know it's, over the years, we've always kind of thought as the meat as the main course and you kind of put your sides around that, what we want you to think about is to make your plant-based foods your main course and put meat on the side. So 2/3 plant, 1/3 meat. And we'd like you to use a lean protein like chicken or fish, but there's also plant-based proteins. And those are things like tofu and nuts and beans. Also important are whole grains. So along with your fruits and vegetables, you want some whole grains. They're loaded with fiber and other vitamins and minerals that are important for your health. Eating fruits and vegetables greatly lowers your risk for lung, mouth, esophageal, stomach, and colon cancer. So it kind of helps your whole body all the way through. Oh, some examples of whole grains I forgot to mention are quinoa, wild rice, and brown rice. So you want to incorporate those when possible. All right, this is a great slide. Limit red meat. What MD Anderson recommends is that you eat 18 ounces or less of cooked red meat per week. And this is a great example. So 2 softballs size servings of meat is about 18 ounces. So if you'd like to eat red meat twice per week, then you could have 2 softball size. 4 tennis balls per week, 6 decks of cards, and so on. So red meat also, many people assume that is just beef. It also includes pork, lamb, venison, and goat. So just keep that in mind when you're preparing your meals, that all of those are included in the red meat category. All right, click the thumbs up button if you think that eating processed meats like bacon and deli meat increases your risk for cancer. And the answer is yes. Eating processed meats like bacon and deli meats, they do increase your risk for cancer. There's cancer-causing substances that are formed in the processing of these meats, and it's what makes them preserved and makes them last so long on the shelf. So that's the process that you want to avoid. So we would like you to eliminate these from your diet. We had mentioned in the previous slide to reduce your intake of red meat, but we would like you to eliminate eating processed meats if possible. And this includes bacon, sausage, hot dogs, pepperoni, and deli meats. And all of these are, I'm giving you a lot of information today, and there are changes that are difficult to make if you try to make them all at once. So we want to encourage you to take gradual steps towards healthier eating. If you're not already eating like this, just pick one day a week and eat all vegetables on that day or all plant-based on that day. Don't try to go straight, no meat all at once. And the same thing will go for exercise and other things we're going to talk about. Let's try to find a balance. Okay, so number 3 is to stay active. Being physically active will help maintain your weight and lower your cancer risk. You want to sit less each day if possible. And I know right now we're all at home because of the quarantine, and we're sitting too much, and this can possibly increase our body fat. And it doesn't only increase your risk for cancer, but also for other chronic diseases. What we would suggest is that you get up and move 1 to 2 minutes every hour that you're awake. And I know I am guilty of this because I will start working on my computer and realize I haven't, stood up in 4 hours. So it's a good idea to set yourself a reminder on your Outlook calendar or on your phone, or I have sticky notes on my computer screen, anything to remind me to get up and move a little bit, and that will help. Exercise also will relieve stress during this time. All right, so MD Anderson recommends you get at least 150 minutes of moderate exercise per week. And moderate exercise are things like walking or yoga or mowing the yard. And these can be broken up into 10-minute increments. So that is very helpful when you're trying to squeeze some exercise into your day. So you can do 10 minutes here, 10 minutes here. That's great as long as it adds up to 150 minutes that week. And if you like to exercise a little more vigorously, then you would want to aim for 75 minutes per week. And this is activities like running or jogging or fast bicycling or swimming. Also important is to do muscle strengthening exercises at least twice per week. And this helps you maintain a healthy weight. The more muscle you have, the higher your metabolism. And then that way, the higher your metabolism, you're burning more calories when you're at rest and not active. So your body's kind of working on your behalf even when you're not exercising. Remember too, with building strength, you don't have to have fancy equipment. You can do body weight exercises. Those work as well. So these are easily done at home. All right, number 4, don't smoke or use tobacco. Tobacco use is the most preventable cause of death. Cigarette smoking is responsible for 80 to 90% of all lung cancers. And smokers are also more likely to have serious consequences from COVID. We've seen a lot of that in the last several months. And quitting now would be a big step towards healthier heart and lungs and your immune system. And there's ways that MD Anderson can help you quit if you want to contact us about that. Smoking, a lot of people think that it only harms your lungs, but it actually causes many cancers: mouth, pharynx, esophageal, pancreas, kidney, bladder, cervix. So as you can see, there's a long list of cancers that are attributed to smoking or tobacco use. So if you don't smoke, are you still at risk? And the answer is yes. Secondhand smoke still puts you at risk for all the things that I've mentioned. And secondhand smoke is smoke that's come from somebody else's cigarette or pipe or cigar. And the best thing to do if you're around someone that is doing that is to do it outside. Just opening a window doesn't quite give you the same effect. You'd like to be outside with open air. All right, the next question is to click the thumbs up button if you think that e-cigarettes are a good way to quit smoking. And the answer to this one is no, that e-cigarettes have not been proven as an effective way to quit smoking. When they first came out, many people thought that that was going to be the case. Turns out it is not. They are not safer than cigarettes. And they do damage your respiratory system and again, make you at an increased risk for COVID complications. Harder, if you do get COVID, it's harder to recover. What has been proven to help smokers quit is a combination of counseling, nicotine replacement, and that's like the patches or the gum or the lozenges, and also there's medication for that as well. So as far as kids and teens, I know there's been a huge increase in this age group and using e-cigarettes and vaping, and any nicotine use before the age of 25 damages the parts of the brain that handle attention and learning and mood and impulse control. So it is very dangerous for kids and teens. And some of the Juul pods, those smaller ones, they have as much nicotine as an entire pack of cigarettes. So although kids or any age really, they think that it's safer and healthier, it's really not. All right, number 5, limit alcohol. There's a lot of research that comes out every year on this, more and more, and drinking even a small amount of alcohol increases your chances for cancer. If you are going for cancer prevention, it is best not to drink alcohol at all. If you do drink, you want to limit yourself to the recommended dose. And so for women, the recommendation is 1 drink per day. And for men, it's 2 drinks per day. And it depends what you're drinking. A serving size of beer is 12 ounces. For wine, it's 5 ounces. And for liquor, it's 1.5 ounces. And drinking alcohol can disrupt your sleep, makes it harder to exercise. You don't make as good a choices as far as eating healthy. And it also has a negative effect on your immune system. So all of those things kind of coupled with the COVID and all the stress and everything else we're feeling right now can really have a detrimental effect. All right, so number 6, we're going to talk about some vaccinations. There are certain viruses that are known to cause cancer. One of them is the human papilloma virus, and that's HPV. It's a very common sexually transmitted infection that leads to many different cancers, including cervical cancer in women and throat cancer in men. It is very common. HPV, about 9 out of 10 people will get HPV or be exposed to it in their lifetime. All right, one more question. Click the thumbs up button if you think that the HPV vaccine is recommended for both boys and girls. And the answer to this is yes, it is recommended for boys and girls now. Years ago, it was only girls, now it's both. The HPV vaccine series protects against cancer. It is safe and effective, and the vaccine can prevent close to 90% of cervical cancer. So that's very encouraging numbers. MD Anderson recommends that all males and females ages 9 to 26 receive the vaccine. It's most effective ages 11 to 12 because it gives the body time to develop the best immune response. Also, it is now approved for individuals, male and female, ages 27 to 45. So you can have that discussion with your physician about whether or not you need that vaccine. Another vaccine is the hepatitis B, and hepatitis B causes liver cancer. So you may have been vaccinated as a baby if you were born in the United States. If not, you want to have a conversation with your physician about that and see if you can get the hepatitis B vaccine. It is treatable if you have it, so that's very good news. But have that conversation with your physician if you're not sure if you've had that vaccine. All right, number 7, get screened. There's many screening recommendations for men and women. We're going to go over them now. It's a lot of information, but Matthew at the Katy Chamber will get this emailed to him, and it's all the information I'm about to go over. So if anyone needs it, they can contact him and you can get it by email. And these recommendations are for individuals with average risk. So keep that in mind. If you have a family history or any other issues that you and your physician have discussed, yours might be a little bit different for this. But on the average, this is what they are. So women in their 20s should get a Pap test, and a Pap test looks for cervical cancer. You do that every 3 years, and also get a clinical breast exam. That's someone done at a doctor's or done by somebody at a doctor's office every 1 to 3 years. And that's women in their 20s. So women in their 30s, you're going to continue getting your Pap test, but you're going to add an HPV test during this age. And you'll do that every 5 years for those, and then continue getting your clinical breast exams. And women in their 40s, continue the Pap and HPV test every 5 years. But at this age, you're going to add a mammogram and continue the clinical breast exam. The mammograms are done every year. And although we haven't mentioned colonoscopies yet, but I want to point out that African American women should begin colorectal cancer screening at age 45. All right, women ages 50 to 75, HPV and Pap test every 5 years until 65, mammogram every year, colonoscopy every 10. And then after the age of 75, we just recommend that you have a conversation with your physician about what screenings need to be continued. All right, for men, ages 45 to 49, you're gonna have a conversation with your physician about prostate cancer screening if you haven't done so already. There are a couple of options, and you'll decide what's best for you. African-American men are also asked to start their prostate screening conversations earlier and begin colonoscopies at age 45 as well. In ages 50 to 74 for men, you're going to continue the prostate cancer screening and then add a colonoscopy every 10 years. And after age 75, just like the females, just have a conversation with your doctor about what's necessary to continue. All right, hepatitis C. Hepatitis C causes liver cancer and a non-Hodgkin's lymphoma. There is no vaccine like there is for hepatitis B that we talked about just a minute ago. Baby boomers are especially high risk for hepatitis C, so it's important to get tested. And the good news is hepatitis C is treatable, and it's got about the treatment's about success rate is about 90%. So that is good news there, but just get tested so you know one way or the other. All right, number 8, protect yourself from UV rays. Skin cancer is the most commonly diagnosed cancer in the United States. And this is from too much exposure to the sun and then the use of tanning beds as well. And the best thing to do is to stay in the shade or avoid going outside between 10 and 4, but obviously that's not always possible. So when you do find yourself outdoors during these times, you want to protect your skin with a broad spectrum sunscreen. We recommend 30 or higher. You want to cover up with a dark, tightly woven clothing. It's very important to wear sunglasses, wear a hat with a wide brim, and that way you protect your ears and your neck. And then just to mention, I know I have been doing this just to get out of the house and kind of away from the computer for a few minutes. I'm spending more time outdoors than I was last summer during regular work time. And so it's a great time to just get into the habit of putting on sunscreen every morning, since most of us are outside just a little bit more. One thing I want to mention about the sunscreen is to reapply. So you want to reapply every 2 hours, especially if you're swimming or sweating. So that's extremely important. So if you just use 30 or higher and reapply, then you'll be protected. So know your family history is number 9. This is the last one. It's extremely important to know if anyone in your family has had cancer. That with your personal health history, you and your physician can make decisions based on screenings that we talked about or any other tests that might be needed. Only about 5 to 10% of cancers are hereditary, but it's important to know that one way or the other. And if you suspect a family member has had cancer, please think about genetic testing. We have that at MD Anderson, and you can get your genetic test and then sit down with a genetic counselor and go over those results and kind of make a decision for your future testing recommendations. All right, so just an overview of what we talked about today. Number 1 was maintain a healthy weight. Number 2, eat a plant-based diet. We talked about staying active. Don't smoke or use tobacco. Limit alcohol. Get the HPV and hepatitis B vaccine. Get tested for hepatitis C and do your cancer screenings. Protect your skin from the sun and know your family history. And as we've discussed, there are many things you can do to help reduce your risk of cancer. And MD Anderson is here to help all the way through prevention, through treatment, through survivorship. Our website is amazing. Here's the website and a phone number. You can call and talk to someone directly if you'd rather do that. Any questions on cancer prevention, or if you are diagnosed or know someone diagnosed, you can go to the website and type in the search bar and get lots and lots of information, or you can contact us directly by getting our information from Matthew at the Katy Chamber. And that is all we have. Patricia, do you have any questions?
Yes, we do have one.
Okay.
It says, are there symptoms to cancer? If so, what are the most common one?
Oh, that is a great question, because there are different symptoms for all the different types of cancers. So what I like to tell people is you know your body, and you need to pay attention to your body and what symptoms you're feeling. If there are changes and some things that you're questioning, then have a discussion with your physician and find out whether or not those are things that try really hard not to Google, because you'll make yourself a little crazy. Just if there are things that are changing on your body and they're not going away and they continue to change, then please just have a conversation with your physician. I mean, it's hard to narrow it down. Everyone is different.
Yes. Matthew, did we have any questions on Facebook?
That was one of the questions that came through, and I guess one other one that I've been thinking of, and you kind of answered it through your presentation, when someone should go get tested, and you kind of gave that through the demographics of the age groups. Is there anything specific about younger children, and I would say toddlers in that age range?
Well, they're normally going to the physician, to the doctor.
Sure.
Pretty regularly. So all I would suggest is if you see any changes in them, to make sure to mention it. And there is no shame in writing notes, because I'm the worst about going to the doctor and saying, oh, I wish I would have asked this. Write down what you need. Be your own health advocate. And if you have young children, you are their health advocate, and ask questions. And if you don't get the answer that you think you need, then keep asking. Don't be afraid of that. Doctors are there and nurses are there to answer your questions. Sure. So don't ever think it's a stupid question, because I'm sure they've heard it.
I'm sure. Well, I think that's all the questions we have today.
Okay.
This webinar was recorded. It will be posted on our YouTube. If you have any questions regarding any of the content that was provided, you can either send them to us and we'll get them to this team to get back out. You can either comment them on the Facebook Live recording or the YouTube recording. So with that, Kendra, Patricia, thank you for your time today. We look forward to seeing you guys again soon.
Thank you, Matt.
Thank you. Thank you very much.
Have a good day.
Bye.
You too.
Bye.